Great. All right. Welcome, everybody, to our March Comagine Health Patient Family Partnership Hub. I'm Laura Jackson. For those of you that don't know, I think we know everyone, though, Director of Community at PFCC Partners. Some Zoom features. We've got the chat open. We've got, if you would like to private chat someone, you are more than welcome to do that by clicking on their name. Let me turn on live transcript for you all. If you need it, on your menu, there should be a CC for live transcript or captions if you would like that. And then if you'd like to come off mute during the discussions, feel free to raise your hand by using the reactions button. And I'll go to pass it to Katie. You're on mute if you're talking, Katie.
I can step in. So at Comagine Health, our mission is together with our partners, we work to improve health and create a better healthcare system so that people and communities will flourish.
Thank you. And we are with PFCC Partners. We're partnering with Comagine Health to facilitate this hub. Our mission is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision at PFCC Partners is a health system transformed, one that works with people and through communities as a partner in their well-being. Our values at PFCC Partners are equity, inclusion, diversity, collaboration, and being solution-focused. This is the Patient Family Partnership Hub. We have all kinds of activities for the hub. We've got engagement opportunities, events, our online community, skills development opportunities, and a lot of you are coming from your existing PFACs, which hold a lot of similar activities. And so this hub is for Comagine Health in general. And our partnership hub meeting agreements we go through before each meeting. A few of these are, we do open 10 minutes prior to start if you'd like to join us to chat and connect before the meeting. We do use a parking lot to table agenda items. And like we said, the meeting is recorded and summaries will be shared out after the meeting. This is our agenda for today. We'll do a quick review of last month's meeting. We had Bert with us to talk about the engagement opportunity journey. We'll talk a little bit about staff evaluations, and then we have we got the COVID vaccine information document back that you all gave feedback on a few months ago. So we want to just give some final feedback if there is any for that document. And then we also have a PowerPoint for a nursing home and to give feedback on that as well. All right, we'll do our introductions. Go ahead and let us know your name, where you're calling in from, and what is your favorite movie genre to watch. So like I said, I'm Laura Jackson. I'm the Director of Community at PFCC Partners. I live in Eugene, Oregon, and my favorite movie genre, I think, is probably like a suspense or mystery movie. I like trying to solve things when watching a movie. Let's go to Anthony.
Hi, everyone. Anthony Sanchez. I'm from Albuquerque, New Mexico. My favorite movie genre is horror.
Nice.
Michael Myers is my favorite.
Nice, nice. Thank you, Anthony. Chris?
Hi, Chris Severson. I'm in Reno, Nevada. I think my favorite movie genre is action adventure. My husband would say it's the Hallmark Channel. but that's to go to sleep to.
Yeah, I
I put
could
it
see
on
that.
at night, 'cause I already know how the plot's gonna end, but I think action adventure.
Nice. Yeah, I like the Hallmark channel around Christmas time. Again, very predictable, but that's why we love it. Thanks, Chris. Jan?
Jan Lambert in Salt Lake City, Utah, and I loved like the Indiana Jones. I guess that's action adventure too.
Yeah.
Good fun movies with happy endings.
Yes. Yes. Thank you, Jan. Katie, if you're available.
Hi, everyone. Sorry, I had to step away. My dogs were losing their mind. So let me only.
Okay.
I'm Katie Frazier. I'm in Portland, Oregon, and my favorite movie genre to watch is probably action as well.
Thank you. Savannah?
Hey, I'm Savannah Smith and I live in Smithfield, Utah. No relation there. I like the suspenseful action-packed movies. Sorry, my dog barked.
All good. All good. And Lindsay.
Hey everybody, it's Lindsay. I'm in Sacramento, California. I would love to go on the action kick, but I'm a comedy buff. I love to laugh, and so I love comedy movies. But if there's a mix of the action adventure and comedy, like I really like the Marvel movies and Thor, I like that. And I can watch them with my son too. So
Yes. Thank you. Thank you. Thank you. All right. So just double check I got everybody. I think so. Okay, we'll go ahead and move on. And I will go ahead and pass it to Lindsay to review last month's meeting.
Thank you. And Katie, Savannah, anybody else, please feel free to jump in. But we just wanted to revisit the discussion that we had with Bert, who is a Comagine Health staff member, who joined us at the last meeting and kind of walked through her process for when they get a new task from CMS, and then all of the steps that they have to take or they consider before bringing anything to patients and families, patient family advisors in the hub as well. And so I was capturing everything as she was kind of talking through that journey. I think one of the main things that at least I took away was the fact that they occasionally get modifications to any new tasks that they get. And when those modifications happen, it just changes everything and kind of changes the course of their projects. So, if you're a patient family advisor that has worked on a specific project with Comagine Health staff, and you're working on an outcome or a product, and then they get a modification, and then they have to kind of revisit and change everything. So what you originally worked on may not be applicable to what's happening now. We also talked about, some of the opportunities for staff to engage with the Patient Family Partnership Hub throughout this journey that Comagine Health staff takes. But we wanted to bring this back, and I think some of you were on the last meeting, and I know we have a few others who are missing who may have additional questions, but just wanted to see if, looking at something like this and understanding the staff side and their roles, the tasks, the things that they have to do, if that was helpful, or what else, would be helpful for you to learn about Comagine Health processes, if that is helpful at all. So just kind of wanted to talk about that for just a minute. So if you were on last month, was this activity helpful to you? And how might we have done it differently or brought you different information that would be more helpful?
I thought it was helpful, Lindsay. I thought it was very helpful understanding the process and what has to be done at different stages. For us as trying to give patient feedback, it was particularly helpful.
Mm-hmm. That's really good.
So-
Thank you, Jen. Yeah. We just wanted to make sure, because we want to make sure that what we're bringing to the hub is, benefiting you as well and how you partner with Comagine Health staff. So I'm glad to hear that. Yeah, because we had another activity that we had thought about doing and walking through a plan, do, study, act, or PDSA cycle that Comagine Health uses frequently. But weren't sure, if that would be interesting or helpful to you as well. So yeah, that's helpful to hear that, understanding their processes was insightful, at least. Any others? And Katie, I don't know if you had any additional questions.
No, I think you covered it well. I think it's this constant juggling of meaningful engagement on the patient family engagement side and the staff side. Like, so the staff they want to meaningful engage, but they also don't want to waste your time, knowing that your time is valuable. So it's that constant juggle. And I think we were hopeful that this kind of process helped you see a clearer vision of what it's like on the other side.
All right. Well, thank you. And knowing that it is helpful to some, helps us too, so we can bring more of that, those learning opportunities to the partnership hub. So, all right. And
I was thinking that this would be helpful for the Utah PPAC to see also, that.
Yeah.
I don't know if someone would want to present that, but I think it would be helpful to them.
Yeah, I was just going to say, I think this is something that we can share out too, just this visual of the timeline that staff goes on. So then you could, pass it along, Jan, or I think
Okay.
happy to come and talk through it too.
So would it be in the form of a slide or?
Probably, yeah, I think that's the easiest way to look at it. It's
Okay.
it's on
Could
a-
I print it out? I mean, some of our slides or some of our meetings are in person,
Oh yeah.
but then I don't know that I'd have a way to show it, so I guess it could be printed out or it could be shared up at a Zoom meeting.
Yeah, absolutely. I think we can maybe put it on a Word document. That's sometimes easier to print out than like a PowerPoint slide or something. So
Okay.
yeah, we can do
And
that.
then also I would be able to, well, I won't waste time now, but I'm not sure how to do that, how to take one that you send me and then present that during a meeting.
Yeah, we can work with you, or we could join you for a meeting too. Yeah, and walk through it at least.
Okay, thanks.
I can connect with you after. Yeah. Awesome. All right, then we'll send this out to everybody too, just to spend more time with it, or even refer back to it when you feel like you're going crazy working with Comagine Health staff because things keep changing. Just a reminder that that is the world that they live in. So, all right, we'll pass it back to Laura then.
Awesome, thanks. Thank you, everybody. All right, and speaking of those engagement opportunities and the process, we have been sending out the staff evaluations. So these are evaluations on those engagement opportunities, just so that we are making sure that we're doing the best we can, being as efficient as we can. So we have one in, so we're still trying to gather some information and on the evaluations, but the one that did fill it out did say that identifying a PFA passionate and knowledgeable about our work greatly improved the outcome. So I think we are making a difference, and you all are getting heard. So good news so far. Any questions or comments on the staff evaluations?
So this is Comagine staff evaluating our effectiveness. Is that correct?
Yes, it's yeah. the PFA, and then also just kind of the process in general as well.
Yeah, that's what I was gonna say. It's more so less about your effectiveness as a patient
Mhm.
family advisor, but more about like patient family engagement at Comagine Health. How that's going, where they see opportunities for improvement and things like that. We also do evaluations after every engagement opportunity is closed. And that's also, you know, kind of about the process of engaging with patient family advisors. And then we typically get really great responses because you all are amazing. So it's just about how much the patient family advisors added to their work. And we're still conducting these evaluations. So hopefully we'll have more to share.
Chris, did you have another? No, okay. All right. So that is the staff evaluations. And then next we have the simple guide to COVID-19 vaccines. If you all remember from a few months ago, they shared, we had Donna on, and she shared this document on the COVID-19 vaccines. And you all gave some great feedback on the documents themselves, one of those being more visuals within the document. I'll bring up the actual, so it's a little bit bigger here for you. More visuals, which they did, you'll see in the next pages, a few pages or so. So I can give you all a moment to take a look at this and let us know if you have any additional feedback to add to this document. Chris, go ahead.
I just loved it. I loved the visuals especially. I did think it was funny though that the person kind of ages, and I don't think that the person ages. I don't think it's proportionate. I think that your vaccine can become less effective over a much shorter time than the person ages. But I really liked the visual because I thought that it really put across the point that we were trying to get to.
Great, thank you. Any other thoughts or feedback?
I really like the wording on this one as opposed to the first one that we saw. I think it's more gentle, more just informative, not coercive. I think it's a good document.
Great. Thank you, Jen. Try not to scroll too fast, but I want you all to be able to read it if you haven't. Anyone else? Next page here. Here's the more graphics. And that's it.
Just wanted to say I like the emphasis because my understanding is that getting the boosters really don't stop the spread. It helps you.
Mhm.
And I like that they're not trying to guilt people into protecting other people, but you're saying this is for you. This will help protect you. And I think that's really important.
Yeah, that's really powerful messaging. Any other thoughts? All right, well, thank you, everybody. I will go ahead and pass that along to the team, and they can disseminate this this document. Thank you all for providing that feedback. All right. So next we are asking for feedback on this this PowerPoint. This comes from the COVID-19 vaccine team, and they're looking to reduce the time that nursing homes take to prepare materials like this. So this will be disseminated out to nursing homes, and it's quick and easy educational materials that's ready for the for the residents and the families at the nursing homes. So we did also share this out. So they're looking just for feedback to make sure, see if there's anything additional that needs to be added, or anything needs to be changed with wording, or again, that the visuals. So we'll go ahead and get going. So the first slide talks just about Comagine Health and the 6 states within the Quinn QIO region. And I can just go slide by slide and see if anybody has thoughts or anything on each slide.
This is just for my information. I thought it was 5 states. I didn't know Idaho was part of Comagine. Is that new?
I don't know, Lindsay or Katie.
I thought, okay.
Idaho joined us when Washington did. So when we merged
Oh.
Health Insight into Comagine Health.
Oh, okay. Because I've been telling everybody it's 5 states, but it's actually 6, eh?
That's okay. My only comment is if these slides are for patients and families, maybe the acronym on the top, or having a page before this, a slide before this, defining acronyms.
That's a good one.
Yeah, and Laura, just to confirm, the audience is patients, correct?
Yes. They said, yeah, they're distributing it to the nursing homes for quick material, for quick education to patients and families, residents and families.
Got it.
All right, and this slide is the system-wide quality improvement. We collaborate with providers, payers, and stakeholders across the healthcare spectrum, as well as community organizations and consumers on systematic initiatives that improve care, delivery, and patient outcomes. There's a lot there.
I don't think that's the slide we're seeing, though. We're just seeing the one that's, or maybe the pictures are in the way.
Oh, maybe.
Oh, no, this slide just says we collaborate with providers, payers, and stakeholders across the healthcare spectrum. You know, I think it could be worded more simply. If this is basically going to families and to people who are in the nursing home, I mean, when you say across the healthcare spectrum, that doesn't mean a whole lot to me. And stakeholder is a funny word to me when you're talking about healthcare.
Yeah, I'm just gonna pipe in. I don't think this is for patients because I've reviewed this. Is this from Shannon?
Yes.
Laura?
Yes.
Yeah, it's for nursing home staff specifically. So we're kind of like educating staff.
Are you talking about all staff, though, all the way from nurses down to the healthcare aides? Because I think there's a lot of aides who this language might be a little confusing.
Yeah, I agree.
Thank you.
Yeah, she just said staff because I had the same question because she had me review it and I was like, wow, this seems like from a literacy standpoint, this seems pretty intense.
Right.
So it's for staff.
Okay.
To understand like COVID boosters to then educate their patients.
So are we talking about like the aides that are on the staff too?
Whoever provides patient care, yeah.
Yeah, I think it still probably is a little too literacy intensive. I think
Yeah.
simpler thing would be better.
You could even say like, what is quality improvement? Because I think you need to go down to that kind of level, and then who is involved and like listing specifics. Jan, to your point of stakeholders, like that's a really
Well, and even the word collaborate,
right.
Especially because a lot of aides may not even be, English may not be their primary language. I don't know if you want to go there, but I'm just saying there's just a lot of, I think it could be stated much more simply.
Mhm. That's a great point.
Yeah.
Unless you're just doing it to the nurses and to the administrative staff. I'm sure they would understand this, but kind of your audience.
Yeah.
Mhm. Ashley?
So I apologize if this has been answered before, but these first two slides as part of this document, is the intention just to give credibility to Comagine as far as, or what's the intention of having these two slides in this particular document?
I would say just kind of as an introduction or level setting of the organization.
Okay, so just to introduce them to who Comagine is in terms of, okay, credibility as far as what they're saying.
Mhm.
Okay, got it. Thank you.
Of course. Great questions. Anything else on this slide? No. All right, we'll go ahead and keep on moving. So the next one says, what does the COVID-19 booster shot do? It's designed to specifically target the Omicron variant. Evidence shows protection after initial vaccination against COVID-19 decreases over time. Boosters help increase protection against the most severe outcomes, and it's designed to strengthen immune systems to better respond to the Omicron variants. Any thoughts on this one? I think this one's pretty straightforward. Okay, go ahead and move on to the next one. Go ahead, Jen.
Well, the only thing I was going to say is this is really impersonal. I guess that's how you want to present it. But, if you were trying to be more personal with the people, designed to strengthen your immune system, or I don't know if that's at all helpful. Otherwise, I don't really have problems with the language. I think it's pretty easily understood, just a little sterile.
Yeah, just a little more personable, maybe. Okay. Thank you. COVID-19 vaccines. What makes the vaccine safe? It's highly recommended. More than 47 million doses administered in the US alone. And Pfizer and Moderna vaccines have received full FDA approval.
I don't think the first one has anything to do with it being what makes it safe, just because it's recommended to me.
That's a good point. Yeah.
Doesn't make it safe.
Right.
I think with the level of skepticism towards these vaccines in society right now, I think you are going to need some more substance to this slide to make it convincing. Because honestly, yeah, the highly recommended, I don't think is wouldn't be very convincing, nor would the doses alone, just because I think most people realize that quite a few, including myself, were forced to take it to keep my job. So that doesn't, necessarily mean it's safe. And there's just skepticism around the FDA approval piece. So I think if you're going to include this, it's got to have some more substance, because there's just too much going around about it. So
Thank you.
I second Ashley's opinions.
Yeah, I agree with that too.
Mhm. So more substance. And
So
maybe-
470 million doses have been administered. Do they have any kind of tracking record with how that is panned out in lessened symptoms, or I don't know, or fewer cases, or I don't know, something like Ashley said, more substantive.
Yeah, definitely more data.
And the FDA approval thing, a lot of people are complaining because they think they were rushed through, right? Now, I got all the vaccines and all the boosters. So I'm in favor of them, but I don't know how big a selling point that is. Maybe they could think that one through again.
And I'm jumping ahead a little bit here, Laura, but I'm
Yep.
looking at the next slide as well, which is a couple more points on just vaccine safety as a whole.
Mhm.
And I just think these two slides are probably the two most important slides that are going to go out in this document. So I don't necessarily know exactly what you can put on there or what, but I like at least Jan's thought process on where to kind of go with that information, because I think more often than not, the first question around these vaccines and why should I get it is going to be around the safety of the vaccines with all of the information out there. So anything I think that you can bring as far as data around that, these are probably going to, I would assume, be the most important slides in the document.
Thank you. Thank you, Ashley. Yes, I agree. I think more concrete.
I actually like this slide though a lot better than the first one.
Okay.
It's a little more specific, but you say hundreds of millions of people have had it and they've been monitored, but what kind of reporting back do we know about all these people having had it, the death rate went down, the hospitalizations went down. Can they prove that was the reason why hospitalizations went down? Because
No.
you got the people got the shots. Well, I don't know. Maybe they have the data, but I think a little more data would be helpful. It says long-term health problems are extremely rare. Well, they may even have the data that says maybe, I don't know, something about that. But you're not convincing me yet, even though I got all the boosters, you're not convincing me yet that I should run out and get another one.
All right. Thank you, Jan. Anyone else? Chris, did you have any thoughts?
The only thought I had, and I haven't found a place for this comment yet, was the seriousness of long COVID. So one of the things that employers are having to deal with, from my perspective, are the effects of long COVID. And it's now risen to be one of the top 20 high cost claims in the US as far as employer medical claims. So I'm not sure if there's a place in here to say it's not just getting the COVID or, having a lighter case, but this long COVID is bad juju. And you really want to steer away from that. I don't know where that might belong in this, but
That's a good point. Yeah, that Yeah, that long COVID is,
And I know there's something coming up. You guys are doing, Comagine is doing something on long COVID. Like within the next week, I think I'm going to a workshop on it.
oh, nice. I didn't.
So
know.
there might be something in that Comagine already has developed that you could just drop in a slide.
Yeah, definitely. Taking some notes here. Thank you, Chris. Anybody else? Right, moving on to the next one. So bivalent versus monovalent. It talks about the different types of vaccines, the bivalent and monovalent. Bivalent is a vaccine with two strains or components of a virus. The original virus, I think that's supposed to be strain, and the Omicron strain. Provides broader protection against COVID-19 illness. Monovalent is a vaccine with one strain or component of a virus and is created from the original strain of the virus that causes COVID-19 illness.
And I feel like this kind of just is like kind of out there. It's just like kind of laying out there. It doesn't say we now have bivalent, which is better. I mean, so what is it that you're trying to accomplish with this slide? You know, maybe we started with the monovalent and now we have bivalent, so it's emerging.
Great, thank you. Yeah, I agree. It's kind of just, here's the information. Any other thoughts?
No, and in all honesty, you should probably just get rid of that part. I seriously doubt anybody would care. And or I don't think they'll read it and say, wow, this is bivalent now. So I think maybe that's just making it longer.
I think, Anthony, too, we're used to multiple strains being in one dose, like just with the flu vaccine, right? We know that they make some kind of cocktail, and you know, we're hopefully getting whatever's going to hit this year in the flu vaccine.
So my guess is this, if this is for staff, it's also to help them answer patients' questions, maybe, right? Or not patients, the residents' questions about, I know when I went and got my last one, I wanted the bivalent. I knew that. So I actually asked the pharmacist, what am I getting? So it's again, probably just education of the staff, right? So they know what to say to a patient. I don't know.
It could be for education of the residents as well, if they're going in to get a booster or their first vaccine, and some of these terms come up that they don't know what each
but
one.
I agree that it should be explained a little bit why you're saying these things.
Yeah, I think so too. An explanation. Maybe these are some terms you may hear when getting your vaccine, or okay.
I think they should be switched because we first had the monovalent. So it should talk about what that is, and then the new improved, right? So I think they should switch the two around.
Okay. Kind of tells a better story.
Right, and say this was originally, this is what was available, the monovalent, and now this is what's available, the bivalent or something.
Okay. Thank you. All right, and then we've got the facts. We've got getting a COVID-19 vaccine is a safer and more dependable way to build immunity to COVID-19 than getting sick with the virus. COVID-19 vaccines can help prevent new variants from emerging, and COVID-19 vaccines do not change or interact with your DNA in any way. And COVID-19 vaccines prevent severe disease, hospitalizations, and death. thoughts on that one?
This is really, really technical, but can we, in the last bullet point, should we say COVID-19 vaccines can prevent severe disease
Mm,
instead of like laying out that it does prevent? Because I don't think that we can 100% say that it prevents severe disease or hospitalization or death. So can, just add that little word in there.
yeah. That's a good one. Small,
The other
but
thing
mighty.
I'm wondering is about adding something that says, something about when you say a safer, more dependable way to build immunity, something about, this, you're in a nursing home. This is a place where we pass it around. So it can make our facility safer if people are vaccinated or something. I don't know. That's just a thought.
Another thought I had, and this is, I have a friend whose mother was in a assisted facility, and when their patients got COVID, they like had to sit at a different table with the other people that had COVID, and it was really hard to manage from a staff perspective. So I don't know if there's somewhere in there where you could say, getting your life will be made a little bit easier, and the people that you are living with, or or living in your facility, it's just easier to manage if nobody gets it, right? Because there's so many accommodations that you have to make when someone is sick.
And talking about staff too, that you're trying to convince staff also that they should be vaccinated. And if staff get sick, then they can't come to work, and so we don't want to get our staff sick either, or something. I don't know.
But
Mhm.
it's true, Jan, and a lot of the things that were put in place for COVID to help us all get over this hump are going away. So a lot of the protections and things that were related to COVID, I know, are starting to go away. So
It's not too different than the flu, once the flu gets rolling in a facility like that, it's really hard to get hold of. If nobody got flu shots, it's kind of, again, protection.
Laura, did you see Katie's comment in chat?
Mhm.
Because I think this would be a good place to put in something about long COVID.
Yeah, definitely.
Mhm.
Good spot. Any other thoughts on this one?
On the first sentence, it's a
Mhm.
more dependable way than what?
Mm,
Than getting sick with the virus.
So it's more dependable than natural immunity.
yes, I think that is.
I think it means then getting herd immunity too, right? This is a better way than just waiting to get for everybody to catch up.
Well, it's also better because if you don't get COVID, then you can't pass it to somebody else. So they get COVID too.
Right?
All right, and then the last, I have a couple more. These are just the resources that they used. And I believe, yeah, they are linked, so people can click on them and go to those resources. And then similarly, we've got the Comagine website and Twitter and LinkedIn for more information. Bye, Chris. Thanks for joining. right, and that is the slide deck. Thank you all for providing all that feedback. I will get this recording and my notes over to the team. Any other thoughts or comments on the slide deck in general? All right, so thank you, everybody. I did want to ask, I'm going to stop sharing here. Lindsay, if you wanted to give a debrief on the focus group that you all had, was that earlier this week?
Was Tuesday?
This week is gone by so
Yeah.
quick.
What's funny is all three of you here were on that focus group, so I don't know how we need to debrief it, but wanted to ask, because each of you did participate, just your thoughts about the process. This was the first time that that team has done a focus group with patient family advisors. So any your experience through the process, the questions that were asked, any additional background you felt like you needed? How did it go from your perspective? I'll say from my perspective, it went really well and it was extremely insightful. And I think both Seema and Alex, I saw Alex just rapidly writing away. And I think they're looking forward to, gathering everything that you shared to be able to present it to CMS that will help inform further improvements when it comes to hospital utilization. And yeah, so I just wanted to say thank you all for participating, but anything that we could do differently on our part. No.
I mean, I thought it went fine. We just appreciate the, opportunity to tell our stories. So
Yeah.
I feel like we're being heard by somebody. It's nice.
Yeah.
It's appreciated. So,
Yeah.
I mean, I know I didn't fit the exact demographic of that particular group. So, I realized that, but I just still appreciated, the opportunity to chat through things. So.
Yeah. And I think even though maybe you didn't fit the demographic, I think that your perspective still helps inform, that entire process overall. Cause, Comagine Health works in other areas that are outside of, just the Medicare beneficiary population, but with hospitals too. So I think it was really helpful either way. And I'm glad you're able to participate too.
Well, I appreciate the feedback that it was worth their time too.
Right.
Right. So appreciate that.
Yeah, absolutely. I look forward to seeing, what's next. And we'll absolutely keep you all in the loop and close that loop for you.
Lindsay, is there going to be, because the maternal health one that I did on Monday too, which I was really, really great. So is that also going to be something that we'll be able to be connected to kind of what happens next as a result of that? Or should we just follow up with Align Innovation or?
We still have, I think, 3 more listening sessions to do next week.
Okay.
And then we'll get with the team to see, what's next. What everybody shared in that listening session will inform the measures that they're going to be developing. So, and the measurement process is insane and long.
Mm-hmm.
So I don't know how long that takes, but I think it would be helpful for not only you, but all the other participants to know like what's going to happen next. So
even the measures they come up with, I would,
that
piece would be super interesting just to see what they get out of it. So
no, absolutely. This is the first step in many. So I think after this, they'll be putting together a committee that will then develop the measures and go from there. So, but no, that's a great point. We'll keep you in the loop. I think for anything, when you're providing so much information and when you're being vulnerable and providing really, really vulnerable information about yourself, you want to know, okay, now what, what's going to be done. So absolutely. Yeah. we'll keep everybody updated. All right, well,
Cool.
more to come there, yeah, but thank you again.
Mhm. It's always great to hear how much value you all gave. All right. Well, we'll go ahead and close up a few minutes early today. I'll stay on for a few moments if anybody's got any questions or need anything. If not, we will see you all either over email or next month's meeting will be April 6th. Thank you.
Laura, I just wanted to let you know that I will probably not be able to be at the April 6th meeting.
Okay.
So I'm out of town all that week, so.
Well, thanks for letting us know.
Yeah, I won't be there either. We're taking the kids to Disney, so.
Ooh, fun.
That's fun. Lucky.
Besides